Yeah, thanks again. Now we are back to action areas regarding hand washing from the case study of Uganda. Like we mentioned, from the case study we can see that at community level, the action areas that were highlighted include the necessity to build awareness of patients, visitors, and the community members on the importance of hand washing in regard to disease spread and its effectiveness. Then the issue of development of information material on hand washing that can be readily availed to the community members and should be translated to easily understandable language for effective communication. Then we have got regularizing of the communication campaigns in as far as hand washing is concerned, and this should be done both at the health centers and within the communities, targeting mostly the vulnerable people who are the children, the mothers, the health staff, and involvement of community health volunteers as a management system is also very important, as we can see from the overall importance of community-based management systems. It is important that we involve community health workers to help us spread this story at the community level. At the health facility level, we ensure maintenance of hand washing infrastructure by regular supply of spares and other consumables like soap, detergents, and we shall ensure that financial flow for operation and maintenance is highly adhered to, with budgets specifically for operation and maintenance of wash facilities to render that they are always functional and not broken down. Then assignment of responsibilities to staff. This is one area which has been noted to be a problem because no one seems to know their roles and responsibilities and as far as wash is concerned. And as such, no one seems to take care of anything. If anything goes wrong, hands are pointed in all directions. Then the importance of guidelines of operation and maintenance should be clear on maintenance of wash facilities within the communities and within the health facilities, and also synchronizing the government O&M strategy with those of international and local NGOs. That seems to have had a clash in between. Then at the hand washing facility level, assessment was carried out of availability of facilities and their conditions, the appropriate number that would be required for communities and health facilities, the consumables and the availability of the supply chain and its importance. Appropriate technology was also mentioned as should be affordable and easy to repair and replace for continued use. Then relevant areas of practical action included establishment of community-based management systems at both community level and health facility level, representation of women on these structures with key roles like treasurers and chairpersons going to women. As we mentioned earlier, these are the key players in water and sanitation sector, so they should be given special consideration in making decisions as far as the sector is concerned. Enhancing community financing for sustainability of facilities, the use of water user committee fees for all beneficiaries who are using water and sanitation facilities. There should be monthly payments for enhancement of sustainability, payments of spares and all that. Support for wash in health facilities should be spread out to not only UNICEF but also to all other development partners. In conclusion, community-based management systems provide a sustainable solution to functionality of our wash facilities and should be supported and all in the sector for disease-free and healthy community. With these systems effectively working, there will be improved functionality of facilities and reduced incidences of patients visiting health centers where the vulnerability is high. So with that, I come to an end of the presentation. Thank you.